Hello, everyone. I'm Kibin Alleyne, and today is Tuesday, August 1st. You are now watching Open, a program that brings the Bronx and New York City straight to you. Don't forget to stay connected with us via social media at BronxNet TV. St. Jude Children's Research Hospital is on a mission to prevent HPV-related cancer. The hospital launched the HPV Cancer Prevention Program in 2021 to raise awareness and increase vaccination rates. The program now encourages a one-time vaccination before age 13 while educating parents and caregivers. Joining me to discuss this effort is the director of the HPV Cancer Prevention Program, Dr. Heather Brandt. Doctor, thank you so much for joining me.
Thank you so much for having me.
Now, I just want to start off, can you just explain what HPV actually is?
Sure. So HPV stands for human papillomavirus, but it's commonly just called HPV by its acronym. And HPV is incredibly common in the United States. It's so common that right now 1 in 4 people have it, and nearly everyone will get an HPV infection in their lifetime. And it's so common, but we don't know in whom it will progress to cause HPV cancers and other HPV diseases. And HPV cancers are, of course, very serious and include oropharyngeal cancers, cervical cancers, anal, vulvar, vaginal, and penile cancers. And what we know about HPV is that we can prevent it, at least prevent 90% of those HPV cancer cases with a safe, effective, and long-lasting vaccine. And so that takes the guessing away. If we're able to vaccinate children on time by their 13th birthday, they're going to get the most protection against these HPV cancers that they may develop as adults.
Now, I kind of want to expand on that. You mentioned the age. What are the benefits of receiving this vaccination? I understand as early as 9 years old, rather than later in childhood.
Yes, so the CDC, the American Academy of Pediatrics, and the American Cancer Society all recommend HPV vaccination on time by the 13th birthday. And the routine recommendation is for ages 9 to 26, but we're really focused in on that 9 to 12-year-old age range for a couple of important reasons. The first reason is that this vaccine is preventive. So that means we want to make sure that children receive this vaccine before they might engage in any behaviors where they could get an HPV infection. So HPV is given from one person to another person during intimate contact. And of course, we know that teenagers and into adults are going to be engaging in these types of behaviors. And so we want to catch them before they're engaging in anything that could allow them to acquire an HPV infection. The second reason is this vaccine works really well in this age group. It produces a really strong immune response. It's so strong that it provides a lifetime of protection when getting this vaccination on time by the 13th birthday. So for those two reasons, it's really important to focus on time. And I just wanted to mention, I know in the open, you were talking about the importance of this, and it is a 2-dose HPV vaccine series by the 15th birthday, and thereafter it's 3 doses. So there's an additional benefit to getting vaccinated on time. It's only 2 doses versus the 3 doses that are required for older children and into adulthood.
Now, can you tell me a little bit more about the HPV Cancer Prevention Program and its efforts?
Yeah, so the St. Jude HPV Cancer Prevention Program formally launched in March of 2021, and this was important for St. Jude. St. Jude is focused on curing catastrophic diseases that affect children. And so you might be wondering, well, why is St. Jude interested in cancers that affect adults? Well, the focus here is on cancer prevention and the fact that this vaccination is focused on children and giving them the vaccine today to prevent those HPV cancers that they may develop in adulthood. So my colleagues work really hard here at St. Jude every single day to treat children and save their lives. And parents and families come to St. Jude for information. And so this is a way that St. Jude can make investments in this space to build confidence in HPV vaccination, to promote awareness of HPV vaccination as cancer prevention, and ultimately think about the potential for reducing the suffering of people in the future as a result of preventing these HPV cancers so that people and families don't have to lose loved ones unnecessarily. And that's something here at St. Jude we know an awful lot about and really has been our mission and focus since our founding in the 1960s.
Now, as I understand that it's targeted, at least for the vaccination efforts towards children, and you explained beautifully why. Should adults look into possibly getting vaccinated as well if they, possibly didn't get it when they were a child?
I'm so glad you asked this question and are giving me an opportunity to respond. So, while our program focuses on that 9 to 12-year-old on time age group, people may still benefit. The routine recommendation is ages 9 through 26. So, anyone in the age group of 9 to 26, and that includes males and females, should get vaccinated in that 9 to 26-year-old age range. For 27 to 45-year-olds, shared clinical decision making is the recommendation. And so this means talk to your healthcare provider if you're in that 27 to 45-year-old age range to find out if you may still benefit from HPV vaccination at older ages. There are certainly benefits to be had across the entire continuum from age 9 to 45. Our focus is really on the children in that 9 to 12-year-old age range for the benefits I mentioned before, getting to them before they may engage in behaviors that they could get an HPV infection. And second, their immune system response. And then I noted I added a third one there. It's only 2 doses. A lot of people don't really like to get the shots, but get them because they're vaccines and they work really well. And so sometimes 2 doses can be a real advantage over 3.
So I just want to clarify on that. So once you get the 2 doses, is that it? Or is it something that you have to do possibly every 5 years or so?
You don't. This vaccine works so well that it produces a lifetime of protection. And so that's regardless of if you get the 2 doses. And it is 2 doses before the 15th birthday. And after the 15th birthday, it's 3 doses. It's also 3 doses for people whose immune systems are suppressed or compromised in any way. But yeah, that's it. Once you complete the series of either 2 doses or 3 doses, you are protected for your life. And the long-term studies show continued levels of protection out to up to 15 years. The vaccine's been available since 2006. And so that's going on more than 17 years now. And the long-term data show very convincingly that protection continues at levels that are going to make sure someone is not acquiring one of the types of HPV that's included in the vaccine, which means that 90% of these HPV cancers can be prevented as a result.
Thank you so much for clarifying that. Now, what are some efforts to educate families on this? I understand that education, just in regards to health, is such an important thing. So can you talk about your efforts to educate families on this?
Yes, a lot of parents and caregivers who are making these vaccination decisions for their children have questions. And these questions have been heightened as a result of the COVID-19 pandemic, where we saw rates of overall vaccination decline. And this was due in part to fewer visits to a healthcare provider for preventive vaccinations. It also could be the product of increased vaccination hesitancy or concerns about vaccines. And so one of the areas that we focus on is building confidence in vaccinations overall, and specifically for the HPV Cancer Prevention Program, building confidence in HPV vaccination. HPV vaccination is incredibly safe. More than 500 million doses have been given worldwide. It has an excellent safety profile. This vaccine's safety or side effect concerns are usually limited very much to pain and soreness at the injection site, maybe a little redness or swelling. There are no documented cases of serious adverse events attributed to HPV vaccine. So first and foremost, we know parents and caregivers want to know it's safe, and it is a very safe vaccine. Another thing that we know parents and caregivers want to know is how well does it work? Does it really work to prevent cancer? This seems like such a long way from giving the vaccine at ages 9 to 12 to preventing a cancer that may not be developed into the 30s and 40s and even older. And we know from long-term studies in other countries, including here in the United States, that this vaccination does reduce prevalence of HPV infection and also prevents actual cases of cancer. In countries where HPV vaccination coverage is high, such as in Australia, Australia is on track to eliminate cervical cancer, which is one of the 6 types of cancers that can be prevented, to eliminate cervical cancer by 2035. So that means no more cases of cervical cancer in a country that really has really high HPV vaccination coverage. And in the United States, we don't have those high levels of vaccination coverage, probably due to a range of factors, including the education and awareness that you mentioned. Also, we need to make sure that healthcare providers are strongly recommending HPV vaccination, even when it's not required for school entry, as there are other vaccines during this age group, that it's still routinely recommended and that they strongly recommend HPV vaccination for cancer prevention. So we want to make sure that parents and caregivers know it's safe, it works really well, it provides long-lasting protection. We also want to make sure that healthcare providers are strongly recommending HPV vaccination and giving it the same recommendation or same strength of recommendation as for other vaccines that may be required for school entry.
Dr. Dr. Brandt, thank you so much for joining us.
Thank you so much for having me.
If you would like to learn more about the St. Jude campaign, what parents need to know about the HPV vaccine, please visit their website, which you can find on your screen below. Don't go away. We'll be back with more Open right after this.